Hi, my name is Soby. I'm a physio at Calgary Core Physiotherapy. I am born and raised Calgarian. I've been working at Calgary Core for about half a year now, and I did my undergrad at U of A and then my master's at Glasgow Caledonian University. I wanted to be a physiotherapist because, you get to be with people, you get to spend time with them every day, you get to help people who are in pain and get them better, but back to being like things that they love. And then another thing is too, it's kind of like you're able to spend so much more time with people other than maybe some other healthcare professions. You might not get that kind of time where you can build that relationship and rapport with people and kind of develop that trust with everyone. And then based off that, create goals and treatment plans that are tailored to those kind of specific people and work with them through their journey in rehab versus kind of, giving them something to go do and maybe not seeing them for a while. This way you follow their treatment plan with them, which is kind of nice. Roll with the journey. You learn about certain people. You kind of like get a vibe as to where they are in life, what they want to achieve. And you usually are able to help them, get past the pain side of things and then get them kind of, training for something they really want to do and actually achieving those goals where, some people are, stuck or wanting to train for a marathon or half marathon. And then you can get them there by working with them and get them to like a personal best kind of thing where you can kind of get that satisfaction. It's quite rewarding to be able to do that for people. The people that I want to see, honestly, is kind of everyone and anyone. It's whoever needs help, whoever is in pain, or even just like wants preventative treatment strategies. Like, come on in, I'll help whatever you need. I can try to help you the best that I can. And if not, we've got like a great team and other resources where we can refer out as well. I do have a background in sports. It's mostly so throughout the winter, I grew up ski racing. So I did a lot of that almost every single weekend. And then that kind of transitioned into something where I wanted to be a bit more team oriented. Although I was with people all the time, ski racing, it's more individual. So then I started volleyball. So I did club volleyball for a bit. And then now basically I'm just trying to maintain those things. So it's nice. It's kind of fun when people come in with those similar sport backgrounds because I can help them a little bit more. And then on the other side of things, throughout life is just being more active in general. So not necessarily as sport specific, but just like getting outside and doing things. A patient that I helped that I'm very proud of is a man who had chronic back pain for a while. So it was years of chronic back pain, kind of tried different healthcare professionals. Just wasn't quite working for him. It wasn't just the best plan, or it wasn't aligning with what he was wanting to do. So kind of sat him down. Sometimes it's trickier in those scenarios where they have seen other people. So you really need to hone in on their actual personal experience and goals to specify the treatment plan towards what they need. So kind of education, working with the patient, obviously a proper assessment, manual therapy, that side of things on our end, but making sure that they can almost tailor the treatment plan and exercise plan to what they do day to day. Because a lot of people too are a bit more sedentary. They're sitting for a long time, so they're not up and moving. So even, giving some exercises for the workplace where you can do those there and you actually get success with it. So we kind of worked for probably a few months on it, and sometimes it's slow with chronic pain, but he was getting those improvements, and it became a bit he was able to actually walk longer or sit longer, or some of those day-to-day activities, those were a lot better. And then it was about, translating those kind of progressions into a sport. So he was able to golf. His main goal was long-term goal was golfing 3 times a week. And then we can get him to that stage where he can go do that and be with his friends or family without pain. But it's truly about, with anyone, creating that personal kind of connection where you can tailor things to what they can do versus being go to the gym and do all this stuff, even if they don't go to the gym normally. So it needs to kind of align with what they value. So when you come see me, it's a one-on-one approach. So basically I'm with you for the whole entire treatment. And what's great about that is we can continuously, I can watch you and see how you progress over time, which is really great. I can watch you do your exercises. We can manage your treatment plan really nicely that way. And it's just a lot better in terms of having that kind of, more, it improves the relationship with the patient as well, where you can just be with them for that amount of time